Good morning, everybody. It is March 31st, 2023. I'm Sam Purser, and if you're taking a look at this, you are a University of Arkansas public health intern that is interested in Washington Regional Hospice. Again, my name's Sam Purser. The other intern, Riley Davis, is out due to an illness. And let's go ahead and get started this morning. So let's meet Riley. Riley is a Washington Health intern. Working through hospice. She's getting her bachelor's degree in public health with a minor in medical humanities. Next semester, she's attending UAMS Bachelor's of Science in Nursing at Accelerated Program, and she's volunteered for hospice before and is glad to get back in the world of comfort care. I'm Sam Purser again. I'm a husband, veteran, father. I'm currently an operations manager at Clorox Manufacturing. I'm graduating with my degree in public health this semester, May 2023. As well as I'm conditionally accepted for a physician assistant program the following year. What really draws me to public health is veteran health. It really evolves around my service as well as policy and epidemiology. I'd like to be the first to welcome you to Washington Regional Hospice. It is a place that promotes comfort, dignity, and peace when families need it the most. It specializes in healthcare programs designed to meet patient needs who are facing terminal illness or life-limiting diseases. It utilizes an inpatient and outpatient model and utilizes a multidisciplinary team, including physicians, therapists, social workers, chaplains, and volunteers in order to stabilize them through their care. Their commitment is to provide the highest quality of end-of-life services available to all who seek it within the Northwest Arkansas community. So, the mission about the agency, Washington Regional promotes comfort, dignity, and peace when families need it the most. Reiterating that statement, the goal is the commitment to provide the highest quality end-of-life care available to all who seek it. Wheeler Walker Hospice Home, or Washington Regional Hospice, is a 25,000 square foot facility located on 4.5 acres. It has 12 private rooms and family suites, glass-walled chapel overlooking tranquil nature reserve. It also hosts a library, kitchen, dining room, a children's playroom, and sunrooms to enjoy. I also want to start out by introducing you to the main preceptor you will see. Her name's Jackie Oxier. Now let me tell you about Jackie. Jackie is down to earth, straightforward, and will get you where you need to go within your internship. She has a slew of ideas to help you facilitate everything that you need and really brings home what hospice is. She is the main volunteer program manager, and then her main counterpart, Alyssa Stewart, is in charge of the bereavement manager. Alyssa is a child life specialist who seeks out the opportunity to work with families and caregivers after loved ones have died. And so with those bereavement phone calls, and you'll learn at this site that bereavement is a major part of the process in order to really capture patient satisfaction rates as well as to tuck in the aftermath of end-of-life services. Which brings me to Riley's project. Riley is in charge of the tuck-in program, and so it is managed by 1 to 2 volunteers that makes calls to hospice families that are caring for their loved ones at home or an assisted living facility. And so one of the goals to the program is to ensure each hospice patient and their family feel supported throughout the hospice journey. And the ways the tuck-in program supports families is by ensuring they have plenty of supplies throughout each week to prevent excess burdens on caregivers, by checking in and allowing the family members to speak to someone outside of the nursing staff, as well as ensuring each family and patient feel supported emotionally, mentally, and medically. So what the tuck-in program really captures with the competency areas is in Area 2, Plan Health Education Promotion, and Area 5, Conduct Evaluation Research related to health, education, and promotion. With my main project here at the hospice facility, I have been able to initiate We Honor Vets. We Honor Vets is a program through the National Hospice and Palliative Care Organization that collaborates between hospice and VA facilities for a partnership that's based around a program on respectful inquiry, compassionate listening, and grateful acknowledgement for American veterans. In partnership, the program allows for the flourishment of how to accompany and guide veterans through their life stories towards a more peaceful ending. And so what this program really does is provide educational tools through educational activities, organizational capacities, and supports the development of strategic partnerships. So what it's really allowed me to do is branch outside of hospice and really gain stakeholders, which brings me to my sub-competencies. It really focuses on 3.2, which is training staff and volunteers, and 5.32, which is facilitate discussions with partners and stakeholders. And so you really have to branch out. You really have to discuss with other hospices, other VA facilities within the local area to make sure you are all on the same page, to make sure you're providing the utmost care for veterans who are at the end of life services. Other projects that we've been working on have been bereavement resources pamphlets, patient and family member satisfaction rates. So if you're looking for a program that allows for you to explore patient satisfaction rates through end-of-life services or through the healthcare system, this is a great spot. Shadowing, you can have multiple shadow opportunities through social work, chaplain, nursing, volunteer, bereavement. There's a slew of opportunities. As well as I was able to gain funding for Veterans Bundle of Care, and then you'll have a lot of direct patient contact, whether it is talking with patients, playing with patients, eating with them, whatever it may be. You'll have a good time learning about their stories, and I really behoove you to go out there and learn their stories. Riley's experience, I'll go ahead and let you read through that. She was able to create her own project, got an opportunity to shadow in different roles, fine-tune her skills for business professional world, as well as develop presentational skills in front of other professionals. My experience was more or less an appreciation for life, a sense of fulfillment and understanding of what really matters. I am just like you, most likely. I didn't know what to expect from hospice. I thought it was more or less a opportunity to see how people died. But it's so much more than that. You really start to understand how these interdisciplinary teams mold together and work, as well as it brings forth humility. It allows the opportunity for fundraising, project management, communication. These are highly, highly desirable traits when you go out into the real world. And I hope you get to experience that too. I want to take the time to appreciate and thank you for listening, and I hope you apply to Washington Regional's Hospice for your internship. There's their information. If you have any questions, please reach out to me. My email is sp091@uark.edu. Any point in time. I hope you have a great day. Thank you. Goodbye.